There is a tremendous number of working poor in Indianapolis, and they're good people. They may be your neighbors.
When Dr. Paula Hall and the rest of the Indianapolis Medical Society researched what could be done to organize charity health care, they discovered a lack of physician coordination and patient documentation kept people from seeing the doctor.
We're capturing people who would never go to the doctor because they were too embarrassed at not having a health insurance card. At Project Health, we give them a card. They have an insurance card. They're like every other patient, that has insurance, and they feel good about that. They have some responsibilities with that. It's like everybody else's insurance. They don't want you just dropping by the ER for routine stuff. Every Project Health patient has a primary care physician, and then they have access to specialist doctors.
Volunteer doctors, along with community, Clarion, and St. Vincent hospitals, have to date donated $7.8 million in care. Project Health Director Carrie Jackson acts as medical traffic controller, matching patients of primary care physicians with specialists.
Go on over and get the ultrasound.
As other doctors hear about our program, they get it in their minds, ooh, I could refer my charity care patients to Project Health. Therefore, that patient can get the tests I order, the MRIs I order, their blood work, their labs. They can get hospitalization if necessary, and then they're going to get better. They're not going to have to come back to me as often. My burden is reduced. The hospital's burden is reduced. The emergency room's burden is reduced. So it just makes sense.
James McConkey's primary care physician noticed something was wrong with his patient and saw Project Health as a perfect match.
Because, I didn't even know I had a brain tumor, and my doctor came to me one Friday, and when he spoke to me, I turned around to greet him, and I just fell on the floor. And he says, well, how long have you been doing that? And I says, well, I thought it was because I was getting old. And he says, no, he said, we better get you an MRI. I didn't know what I'd do. I didn't know where I'd turn or how I'd handle this because I didn't have no insurance.
Oh, hi, Mr. McConkey. How are you?
Neurosurgeon Dr. Aaron Cohen-Goodall volunteered to help, and Mr. McConkey went from MRI to brain surgery within 24 hours.
And my strength is back. That's when my friends called me and told me about Project Health. And I couldn't believe there was such an institution as Project Health. And then the way I was treated, I probably got treated better than if I was a millionaire.
During surgery, when we opened the brain, we found a sizable tumor that was pushing on the normal healthy tissue. And as you can see, this is the large lesion by the size of an egg. Had we not done the surgery, the tumor most likely would have continued to grow, causing further compromise of the brain and therefore worsening of the weakness on the right side and possibly eventual paralysis.
It makes a person feel wonderful, just wonderful. It really does. And to know that there's this many nice people and good people in the world. And I feel very, very, very fortunate. I certainly do.